Good day. Welcome to the Febrile Seizure online session. I am Dr. Christine Latorre Mendoza, a pediatric neurologist. The objectives of this session is to correctly diagnose a child with signs and symptoms of febrile seizure, to appropriately manage a child with signs and symptoms of febrile seizure, and to properly refer a child with febrile seizures to the resident or consultant. Febrile seizures are seizures with fever in children who have suffered a previous non-febrile seizure. Febrile seizures are to be distinguished from epilepsy, which is characterized by recurrent non-febrile seizure. Febrile seizures are events in infancy or childhood, usually occurring between 3 months to 5 years of age, associated with fever but without evidence of intracranial infection or defined cause. But a more later definition of febrile seizure is that it is a seizure occurring in childhood after 1 month of age, associated with a febrile illness, not caused by an infection of the central nervous system, without previous neonatal seizures or a previously unprovoked seizure, and does not meet the criteria for other acute symptomatic seizures. Febrile seizures could either be classified as simple or complex. Okay. The symptoms duration in terms of recurrence within the first 24 hours is the one that helps us recognize which is simple and complex febrile seizure. In the simple febrile seizure, usually they present with generalized seizures, less than 15 minutes duration, no recurrence within the first 24 hours, and absent focal neurologic signs. While in complex febrile seizure, usually they present with focality, more than 15-minute duration, they may recur within the first 24 hours, and focal neurologic signs may be present in the postictal period. Worldwide, it may be at around 1 to 14% of children may have febrile seizures. Febrile seizures recur in approximately 30% of patients and most commonly between the ages of 6 months to 3 years. For children who had febrile seizures, they also have an increased probability of developing epilepsy to around 7% compared to the general population. Why should a rise in temperature cause a seizure? Okay. Because of the GABA receptor mediated inhibition that is greater than the excitatory phase, thus appearing to be the increased release of GABA in the presynaptic terminals, and then hyperthermia potentiates the release of the release of the GABA, which causes more the development of seizures. Risk factors in the development of febrile seizures include early age at first seizure, the family history of febrile seizure, the duration of febrile illness, which means that the shorter the febrile seizure period, the higher chance that they develop seizures within the first 24 hours, the presence of prior neurological abnormalities, and history of complex febrile seizure. The risk of initial febrile seizures has also been studied after the receipt of common pediatric vaccinations such as DPT and MMR. And they found a fourfold increase in the risk of the febrile seizures within the first 3 days from the receipt of DPT vaccination. It is not directly related to cause febrile seizure from DPT infection, but rather it's more of the content of the whole cell pertussis vaccine that potentiates the occurrence or the trigger the occurrence of febrile seizure in this population. With regards to MMR vaccination, the risk of febrile seizure increases by 1.5 to 3-fold, with the peak occurring within the first 2 weeks after vaccination, and an additional 25 to 34 febrile seizures have been estimated to occur per 100,000 doses of MMR administered. Among the predictors of recurrent febrile seizure include a history of focal, prolonged, and multiple seizures, usual viral infection, family history of febrile seizures, the onset of febrile seizure before 1 year of age, temperature less than 40 at the time of seizure, and a history of complex at the first onset of febrile seizure. Genetic aspects have been clearly established in the etiology and pathogenesis of febrile seizure. A history of febrile seizure amongst first-degree relatives is common, and in concordant rates with febrile seizures, which are much higher in monozygotic than in dizygotic twin pairs. Reports in the literature have described a connection between febrile seizures and various chromosomes including 2q, 5q, 5, 8q, and 19, which appears to be associated with changes in the neuronal sodium channel function. In the evaluation of pediatric patients with febrile seizure, especially first-onset febrile seizure, the Child Neurology Society of the Philippines strongly recommends doing lumbar puncture, particularly for patients with first-onset febrile seizure less than 18 months of age. With regards to EEG, in the guidelines of CNSP, we usually recommend the use of EEG only for those with complex type of febrile seizure. In general, neuroimaging does not have any role for febrile seizures. Initial management include aggressive control of the fever, which includes the use of antipyretics, and possibly identify what triggers the fever. Tepid sponge bath would also help a lot in bringing down the temperature of the body of the patient. The role of intermittent diazepam and continuous phenobarbital in patients with febrile seizure has long been debated. Is it really necessary to give anticonvulsants, therefore in general, to prevent the recurrence of febrile seizure after the first febrile event? Studies according to Nelson and Ellenberg, there are about 50% of children experience a second febrile seizure within 6 months from the first seizure, and 75% within a year, and 90% within 2 years from the first episode. In summary, in this study about intermittent diazepam and continuous phenobarbital treatment of patients with febrile seizure, there's a systematic review with meta-analysis that showed that prophylaxis with either phenobarbital or diazepam may help reduce the recurrence of febrile seizures. However, based on these studies, these are all clinical, methodological, and statistically heterogeneous. To date, there hasn't been any good recommendation in long-term use of phenobarbital and diazepam in making sure that the recurrences of febrile seizure would really be abated. In these following slides, as a student, it is very important for you to remember and go through this information, which are very simple for you and for your patients' education. In summary, febrile seizures in children, although primarily benign, can be frightening and anxiety-provoking events for parents and caregivers. Therefore, it's important that healthcare providers like us understand the potential parental misconceptions, anxieties, and fears about fever and febrile seizures so that we may help them allay those fears effectively. Thank you very much for listening.